host, Brad.
And Logan.
And today we are going to be talking about the Lower Extremity Functional Scale. So I hope you guys are excited. We're going to be talking about what it is, why it's important, and how it can be utilized in clinical practice. But so Logan, why don't you kind of just start us off? What is the Lower Extremity Functional Scale?
Yeah, the Lower Extremity Functional Scale, so it's going to be a self-reported, kind of patient-reported outcome measure that you can use with your patients in the clinic, either kind of before eval or also to kind of track patient progress throughout your kind of continuum of care. And it's kind of a 4 subgroup 20 question measure with things like squatting, walking 2 blocks, getting into and out of a car, performing various activities of daily living to assess if they're having difficulty with that. So it's on about a 0 to 4, well, it is on a 0 to 4 scale, 0 being extreme difficulty and not being able to perform it. 1 would be quite a bit of difficulty, 2 is moderate difficulty, 3 would be a little bit of difficulty, and 4 is no difficulty at all. And 80 is the kind of high or the top score. So 80 is you're not having any limitation at all with anything. And 0 is you have extreme difficulty with pretty much everything. So again, you want a higher score, and lower score would indicate more limitations in function.
Cool. Yeah, I don't know. I think when we had talked about doing this together, we had both done our outcome measure assignment on it. But I think I was really interested in this outcome measure just because, I've never seen it before this class. I've never seen it used in clinical practice. And so we kind of wanted to make this whole episode on reaching out to the clinicians, reaching out to students, and just all healthcare practitioners about implementing this well-researched, this very highly validated outcome measure. Because I don't know, Logan, have you ever seen this outcome measure used before?
Yeah, we've had our kind of integrated clinical experiences, and from my experience, I haven't, even in the outpatient setting, I haven't seen it used as heavily as I thought it would be used. I thought it would be used a lot more than what it potentially can be.
Yeah, I totally agree. I think from the outcome measures that I have seen used, this was definitely not one of them, which again I thought was kind of surprising after learning about it, because it's just so well validated and it's very reliable, and it's actually mentioned in a couple of CPGs that we'll kind of talk about later on. But we've kind of talked about what's on it, how it's graded. So how is it actually used? I think the way that it's most commonly, right, it's just a questionnaire. It's like a sheet of paper, really easy, really simple to administer, which I think in theory should help it be more applicable. I don't know, Logan, when we were looking it up, but I just typed in on Google Lower Extremity Functional Scale and I found it for free.
Yeah.
And so I feel like that accessibility should make it, more appealing to therapists and clinicians to use it for any lower extremity injury. Do you know any of the conditions that it could be used for?
Yeah, really any kind of lower extremity injury that's limiting your function. I think it's been validated in, like we said, different CPGs like hip OA, plantar fasciitis, lateral ankle sprain, also Achilles tendinopathy. And those are just the CPGs with kind of that A-level evidence, so it's going to be strong. But I feel like you can use it with a lot of other different lower extremity injuries that aren't just in these kind of CPGs. But Brad, that's a good point that you brought up earlier. Is this is free and very accessible. We know some other outcome measures that we've learned in classes where, you might have to get continuing education to even administer this outcome measure.
Mm-hmm.
So the fact that it's free, you don't need the continued ed to even administer it, makes it really kind of easy to put into clinical practice, and you don't have to hop through as many hoops as you might with different outcome measures.
Yeah, I totally agree. And actually, as we were researching, I came across a systematic review that was published by the Journal of Orthopedic and Sports Physical Therapy back in 2016. And this was just looking at the lower extremity functional scale, seeing is it reliable, is it Is it valid? And yeah, they concluded that the LEFS was highly reliable, highly valid, and had really good responsiveness. And they found that they could use it right, like you mentioned, right from the examination all the way to the end of care, and like tracking it, using it to see, okay, how is this patient progressing? What interventions are working? So there's like so many ways that you can use this rather than just, okay, is the patient doing better? But like I think another thing where I was looking in our research is that some people can use it for research. So if you're trying to figure out, okay, is this intervention working for this patient, you can use this lower extremity functional scale as like a test and a retest for whatever intervention that you're trying to test. So I thought that was super interesting. I didn't think about using it that way, but yeah, I was like, okay, yeah, that makes a lot of sense. I think that's really cool.
Yeah, I mean, I agree with that 100%. And I think going off that too, and what I've thought about too when doing this initial kind of project with the lower extremity functional scale is like how not only you can track it to see like if your patients are, recovering to where they want to be, so getting higher on that scale, but also just like the ability to actually target your interventions to what the patients are having problems with. So like, say if certain patients are scoring high on some aspects but low on others, like for say like squatting or putting on your shoes or socks, then you can directly kind of link their body structure function impairments to those limitations and be able to see, okay, let me do this intervention because this is going to target squatting or putting on your shoes and socks more than sitting for 1 hour would be, or getting in bed or stuff like that. So I think you're able to it's able to help you target your interventions to what your patients are actually having problems with.
Yeah, and I think just like when we're thinking about big picture application, like why do some PTs not use like outcome measures like this? I think they try and use, I think like there was one place that I was at for a clinical rotation where they used one outcome measure for every patient, and it was like just a super general, which is like, fine, it's quick and easy. You don't have to figure out which one you're going to use.
Right.
But, right, is that going to be as valid as something more specific like this where we're talking about the lower extremity only?
Yeah.
And, right, obviously, like, if someone has an upper extremity injury versus lower extremity, like, that's going to look very different. And so I think it's really good that we have this lower extremity specific that is really reliable and really valid, and it has so much strong supporting evidence. So yeah, I think that's really important to make sure that we're educating like students and also PTs so that they know that, okay, this is actually really good. So why don't we use it? Like we mentioned before, very easily accessible, easy to administer. I mean, really, all you got to do is give them the paper and just let them do it. It takes a couple minutes, and right. And so I think, one of the barriers that I've noticed is just like lack of awareness. And I think there's like a perception that, oh, I need to know how to use this. But, I mean, there's really not that much to it. I don't know if you have anything else like...
Yeah, I mean, it's really just like you can have the patient fill it out before your initial eval in the waiting room. And even like I've seen different outcome measures that you can just like have a conversation with your patient. Like if they're having difficulty going through it themselves, like you can have that conversation with them. It's still going to be their like self-reported pain and self-reported difficulty, but just going through it with them, like asking them, hey, on a scale of 0 to 4, 4 being you don't have difficulty with it at all, how are you with squatting? How are you with getting in and out of the car? And asking that conversation, building that trust, building that rapport with the patient. So it can be used in multiple different ways. And just kind of going back a little bit to like its validation, and also tying it into like how it can be used. I mean, this has been validated in many different languages too. Oh, yeah. So like Dutch, Chinese, Turkish, and several other languages. So this is also validated in those languages. So those populations that you're seeing that, you know, you might need a translator for, or stuff like that, you still can use this measure because it's still validated in those populations.
Yeah.
And also going back to a little bit about the like statistical validity or kind of tracking patients over time is they have reliable research on the clinically important difference, right? So making sure that the therapists and also students that are kind of learning about this measure know that like you can track patients via this minimally clinically important difference. So if your patients are making like a 9-point improvement, you can actually say that it's significantly it's a significant improvement. They're making the progress that they need to make, and that you're like Brad, you mentioned, like being able to track if your interventions are actually making a difference. Like if they're improving 9 points, then you can say, hey, our interventions are working. Like let's keep going with this, or let's progress this, because this is something that, you know, if you saw that they weren't making that difference, then you can be like, okay, hey, I need to make a change. Like things aren't working here. Why is this? Are my interventions not targeting the right thing? Is maybe I need to look at my differential to see if that's not where it should be, you know? So I think it's giving you a lot of different information on just, not just simply like what they have problems with, which I think sometimes people see these patient reported measures, it's like, it's just another like simple chart that like what's going to help. But like if you really use use it to its full extent, I think it can be very, very helpful.
Yeah, I actually really, really like that point that you made, that so many clinicians, right, or like when you go to the clinic, you fill out this chart and the PT looks at it for like 2 seconds and they're like, okay, you have issues with this.
Yeah.
But I really liked that you talked about how if you actually look into it and read through each point and think about like, okay, as the patient is progressing through therapy, like have they gotten better? Like you talked about it influencing your interventions, influencing your differentials, and like just using your clinical reasoning as to like, why is the score changing? Why is it not changing? Why are some activities getting better and some are not? So I think like there's a lot of power. It depends on the user. And I feel like as clinicians, there's always this barrier of like, I'm just not going to think about it. I've got a million other things to think about. But I actually really like one of our professors. He told me that we try and be more efficient, and sometimes we think if something's not important, we'll just brush by it. But he's actually telling me that you can actually be more efficient by being present in the smaller details. I think because then if you really think about each like let's say we're talking about the differentials, like if you just go straight to your specific like tissue differentiation tests, like yeah, that's like faster, but it's actually going to make your clinical reasoning and coming up with your differentials more challenging. And so basically what I'm just trying to get at is that if you, like you mentioned, if you really just take your time and look at each thing, think about why is that an issue? How can I use this information to guide my treatment, my plan of care, right? It's actually going to make everything a lot more streamlined. And so I think that's kind of where the next step is for people who are already using it. So don't just take it for the sake of, I know what's you're having trouble with, but right, let it guide your intervention, let it guide your differentials, and then from there just keep going with your plan. But let's take a quick chat about just some of these CPGs. Out of the many CPGs that we've seen in the lower extremity, it's actually very surprising. 4 of the CPGs, 1 in the hip and 3 for the ankle. All 4 of these CPGs had A-level evidence for the use of the lower extremity functional scale as a self-reported outcome measure. So there was hip OA, there was Achilles tendinopathy, lateral ankle sprain, and plantar fascial heel pain. I just think that's like super important. I think there's so many people with those issues, and so I guess like for the patient, obviously if you're a patient, like you're probably not going to know or care what the lower extremity functional scale is, but I think as clinicians, we know that we're going to see these patients a lot, this patient population a lot. And so I think having the lower extremity functional scale ready to go, for those patients, right, it's just going to help the entire plan of care and the entire process. But yeah, I think that's
Yeah. Yeah, I mean, I agree with those points. I mean, going back to those CPGs, I mean, all those lower extremity conditions it's going to be a lot of what you see in outpatient. I mean, you're going to see hip OA, you're going to see the plantar fascia pain, you're going to see Achilles. I mean, when I was in my ICE, I saw all of that multiple times. So
yeah.
it's not like it's some obscure condition or pathology that you need to make sure that you use a scale with. I mean, you're going to be using it consistently.
Yeah.
And also, I mean, there's research that's been done on using this, in inpatient as well, not just outpatient.
Yeah.
So people coming back from total knee replacements, total hip replacements, like being able to use the scale to say, hey, are they, getting better? But also, like, it can also provide information on like what setting they need to go to next, right? So like, do they need to go to subacute? Are they still having tremendous limitations? Stuff like that.
Yeah. And yeah, I think going off of that, like, not just the ortho population, but what about like the neuro population? Getting back to like those functional activities. I think that's another place where this scale can be used. I think like typically we think of like in the neuro population they use a lot more specific outcome measures, like the PASS or the TIS or like the Berg balance. But right, like these outcome measures you can be used in any setting, and so I definitely don't think that as clinicians like we should feel limited to when and where we can use these outcome measures. So yeah, I thought that was a really interesting point that you brought up, right? Not just outpatient but inpatient, sniffs and your neuro rehab, all of these places where you can use this to help guide treatment.
Yeah, I mean, like and what professors have always told us too, and what we like as I've become more and more experience with treating, patients at clinical experiences or more and more experience just in the field of medicine and physical therapy itself, is like just because you're in a certain population doesn't mean they're not going to have impairments or deficits that technically a different population wouldn't see, right? So like you said, like your neuro patients are still going to have musculoskeletal impairments.
Yeah.
So being able to, go back and forth between not just, neuro validated outcome measures, but being able to use your musculoskeletal outcome measures too. And it goes both ways. I mean, I think just being cognizant of knowing that you're going to be a better clinician and you're going to give your patients better outcomes if you don't have that kind of tunnel vision.
Yeah.
And I think this is just another way of, being able to have as many tools as you can to treat as many patients as you possibly can as well. So.
Yeah, I totally agree. So let's just kind of wrap it up. What are some like big picture things to know about the lower extremity functional scale? I think first and most important thing is that this is for the lower extremity. So you got to remember that. That it's graded from 0 to 4, 0 being extremely difficult, and 4 being no difficulty at all. So generally, the higher the score, the better. The lower the score, the greater the difficulty. What's another point you think it's a good takeaway?
Yeah, I mean, I think it's validated in many different conditions, musculoskeletal conditions to be specific. So your hip OA, your plantar fasciitis, your Achilles tendinopathy, and also that it's validated in many different languages. Being able to track your patient's progress and being able to target your interventions is a huge key in being able to optimize the tool to its full extent.
Yeah, and I think just the last thing that we, if anything, we want to make sure that clinicians are using this. I think is that it's so easy. I think that's like the big thing.
Yeah,
it's a great tool, highly researched, and it's free. You can find it. Literally, just type it up in Google. It'll be the first thing that comes up.
Yeah.
And all it takes is saying to the patient, "Hey, can you take 2 minutes to fill this out for me?"
Right.
That's all it takes to utilize it. So it's like, why wouldn't we?
Why not?
You know? Why not? Exactly. But yeah, I think that's gonna kind of wrap up today's episode. I hope it was really informative. And then that we are seeing more of the lower extremity functional scale used in clinical practice.
Yeah, awesome. Catch you guys next time on the Daily Goni.